Erectile dysfunction and prostate problems often show up around the same time in a man's life, usually after the age of 50. But here's the question. Are they just coincidences, or are they truly connected? And more importantly, what role does a urologist play in managing both? Many men think of ED as simply a performance issue and prostate problems as just urinary trouble. In reality, the two are deeply linked. The health of your prostate can directly affect your ability to achieve and maintain an erection, and the treatments for prostate conditions can also influence sexual function. Ignoring one while treating the other often leads to frustration and missed opportunities to protect overall health. The truth is, ED and prostate health are two sides of the same coin, and understanding that connection could save not only your confidence, but also your life. In this video, we'll explore how they're related, the warning signs you shouldn't ignore, and the treatments a urologist may recommend. To understand the connection between erectile dysfunction and prostate health, it helps to look at the anatomy. The prostate gland sits just below the bladder and surrounds the urethra, the tube that carries urine and semen out of the body. Because of this location, any change in the prostate can directly affect both urination and sexual function. When the prostate becomes enlarged, a condition known as benign prostatic hyperplasia or BPH, it can squeeze the urethra and disrupt the normal flow of urine. But it can also interfere with ejaculation and contribute to difficulty achieving or maintaining an erection. If the prostate is inflamed, a condition called prostatitis, it can cause pain, pelvic discomfort, and reduced sexual desire, all of which make erectile dysfunction worse. And of course, prostate cancer or its treatments, such as surgery and radiation, can damage the nerves and blood vessels responsible for erections. It's also important to remember that even medications used to treat prostate conditions can have side effects that impact sexual function. Drugs prescribed for BPH, for example, can sometimes lower libido or cause difficulty with erections. That's why urologists often say prostate health and erectile health are two sides of the same coin. You can't fully treat one without considering the other, and that's exactly what makes the urologist perspective so essential. There are three main prostate conditions that commonly affect erections, and understanding them is key to protecting both sexual health and overall well-being. The first is benign prostatic hyperplasia, or BPH. This is an enlargement of the prostate gland that often happens as men age. Because the prostate surrounds the urethra, an enlarged prostate can squeeze that passage, making it harder to urinate. But the pressure and changes in blood flow can also interfere with ejaculation and contribute to erectile dysfunction. Men with BPH often experience both urinary problems and difficulties with sexual performance. The second condition is prostatitis, or inflammation of the prostate. This can be caused by infection or chronic irritation. Symptoms often include pelvic pain, painful ejaculation, and reduced sexual desire. Even when erections are physically possible, the discomfort and reduced libido can make sexual activity difficult, leading to ongoing ED issues. The most serious condition is prostate cancer. While the cancer itself can affect function, the bigger impact often comes from treatment. Surgery and radiation, while life-saving, can damage the delicate nerves and blood vessels needed for erections. Many men experience ED following prostate cancer treatment, which is why urologists often provide specialized rehabilitation plans. The key point is this: prostate conditions don't just affect urination, they directly influence erections and overall sexual health. That's why managing both together is so important. When men first notice erectile dysfunction or urinary problems, many start by visiting their general doctor. And while that's a reasonable first step, general practitioners usually only provide basic evaluations and may prescribe medication. What they often cannot do is fully assess the complex relationship between erectile function and prostate health. This is where a urologist becomes essential. Urologists are specialists trained to understand both conditions in depth. They can perform a PSA test and a thorough prostate exam to screen for enlargement, inflammation, or cancer. At the same time, they evaluate hormone levels, blood flow, and nerve health, all of which play a role in erectile function. Most importantly, a urologist knows how to balance treatment. For example, if a man requires therapy for prostate cancer or BPH, the urologist will consider how those treatments may impact sexual performance and create a plan to protect erections as much as possible. They can also recommend rehabilitation strategies after surgery or radiation to help restore sexual function. That's why experts often say, a urologist doesn't just treat the prostate or the erection, they treat the man as a whole. By looking at both sides of the problem together, they provide solutions that improve not only urinary health and cancer outcomes, but also intimacy, confidence, and overall quality of life. When it comes to treating both erectile dysfunction and prostate problems, a urologist has a wide range of tools, and the approach is always personalized. For men with mild ED, the first step may be oral medications like Viagra or Cialis. These improve blood flow and often provide reliable results. If hormone imbalance is detected, the urologist may suggest testosterone replacement therapy to restore energy, libido, and overall well-being. Lifestyle adjustments are also a core part of treatment. A urologist may encourage healthy diet, exercise, better sleep, and stress management changes that support both prostate function and sexual performance. For men with an enlarged prostate, there are several minimally invasive procedures, such as laser therapy, TUMT, microwave therapy, or urolift implants designed to relieve pressure on the urethra without severely impacting erections. In more advanced cases of ED, options like penile injections, vacuum erection devices, or urethral suppositories may be recommended. And for men with severe or long-term dysfunction, penile implants can provide a permanent, highly effective solution. For prostate cancer patients, treatment plans are carefully balanced to fight the disease while preserving sexual function as much as possible. Urologists may even recommend rehabilitation programs after surgery or radiation to help restore erections. The key message is this: treatment isn't one size fits all. A urologist tailors care to each man's unique needs, protecting prostate health while restoring sexual confidence. Two goals that go hand in hand. Men, if you're over 50, here's the truth. Your prostate health and your sexual health are deeply connected. Erectile dysfunction may not just be a performance issue. It could be the first sign of an enlarged prostate, inflammation, or even cancer. And prostate problems don't just affect urination. They can steal your confidence, your intimacy, and your quality of life. That's why seeing a urologist matters. A urologist has the tools and expertise to check your prostate, evaluate your hormones, measure your blood flow, and create a plan that protects both your health and your erections. So don't ignore the warning signs. Don't just cover them up with quick fixes. Make the appointment. Ask the questions. Get the tests. Because when you take action now, you're not only protecting your confidence, you're protecting your future.